Good afternoon, everyone. Thanks so much for joining us today on this Valentine's Day. What could be more appropriate than talking about our hearts? And not just in an emotional sense, but this time in a physical sense. Let's talk about heart health, because most women, as you know, are nurturers and welcome taking care of others. Now, they need to get serious about their own health. We all do, because heart disease has become the #1 killer in America. The symptoms of a heart attack are quite different in a woman than a man, and women need to learn to recognize the signs in order to survive.
This is something that you're not going to wait until you're 40 to start screening and to start preventing. We have to try to find a time for ourselves. It is extremely important. Do not forget about yourself. You have to start working on you so that you can be present for the ones that you love.
About half of hypertension patients are women, and more than half of those taking medication don't adequately lower their blood pressure. Still, much of the science to understand and treat hypertension has been done in men. And that's where our first guest comes in. Dr. Jennifer Sullivan just received a $400,000 grant from the American Heart Association to look deeper into the role salt plays in women's blood pressure. And Dr. Sullivan is a physiologist at the Medical College of Georgia at Augusta University. And Dr. Sullivan, you have found that better hypertension treatment in women, to get it, we need to understand the role that salt plays on blood pressure.
Right. So like you mentioned, most of the studies have been done in either men, excluding women from clinical trials, or in male animal models. So the paradigm that we're using to try to control blood pressure in women is based on men, and women aren't just, different scaled versions of men. They have unique physiology that we need to understand before we can attempt to control blood pressure rates the way they need to be.
The blood pressure rate is so important because it all ties back to the heart.
Right. So having high blood pressure is a risk factor for a number of different things. It's one of the primary risk factors for heart disease, which is the leading cause of death among men and women in the United States. So knowing how everything impacts that, all the things you eat and everything else becomes important.
What made you become focused on sodium, or is that just a natural thing when you're talking about blood pressure?
So it's kind of been a progression. I mean, really, my entire scientific career has been focused on understanding cardiovascular health and function in females. It's been neglected for so long, and it's something
that's really shocking, isn't it?
Yeah,
that women's health has been neglected.
Well, I think there's lots of reasons for it. I mean, historically, the drug trials that included pregnant women having teratogenic effects and problems in pregnancy really scared people off in the 70s, and then women were just excluded. So there was a reason for it, but now we're dealing with those consequences, and those consequences are we just don't have drugs to treat these diseases, and we don't understand them. So you mentioned heart disease. So doing tests and different exercise tests and things to see if a person's having a heart attack, all of that is based on presentation in men, and how women present with a heart attack
So
is
you're
different.
talking about like the stress test?
Yes.
Okay.
Yeah, the stress test. Women and women respond differently.
Okay.
So women, and also when you have a heart attack, men, it's the classic clutching of the chest, heart pain. In women, it's entirely different. It's lower back pain, it's fatigue, and it might not necessarily has immediately been identified as having a heart attack. So women have been less likely to understand what's going on, so they don't go to the ER, they don't get treatment, and when they do, the tests that are used to say if you're having a heart attack don't work as effectively in women. So it's been problematic.
What would you say for your goal is once this study is complete? What do you think science will learn from it? Is it mainly to target the right medication that is going to work for women?
Ultimately, obviously, yes. I mean, I think that's what we need to do. One of my goals is really just to, in part, just to increase awareness. Make people understand that you can't take a one-size-fits-all male model and apply it to all patients. So now we're talking about men versus women. Are you talking, it applies equally well to Caucasians versus African Americans? I mean, the populations that are taking these things are different. You need to understand the underlying physiology, the underlying disease process to really get ultimate.
I think we look at a medicine bottle and it'll always say, adults so much, child so much, but boy, it's way more delicate than that, isn't it, when you're talking about something like blood pressure medicine?
And we're really just starting to understand, with all medications, we're really just starting to understand, the whole personalized medicine approach and understanding how women versus men. We're very different.
I neglected that you're also a pharmacologist.
Yes.
So that you've got both sides of it there.
Yes, I do.
The physiology and your understanding the whole drug concept. Well, we appreciate the work that you're doing. Anything you can tell us right now that, just as a general rule, will help us when it comes to blood pressure?
Be aware. I mean, obviously the same things apply. Exercise, taking care of your health. So for sodium, sodium is hidden in everything. Look at labels. Actually look and see what and it's in processed food. So the more you can, eat healthy, cook your own food, fruits and vegetables, having a healthy lifestyle will promote not only healthy overall health, but cardiovascular health as well.
And that's what we're talking about this month. And we appreciate you helping look out for our hearts.
Oh, my pleasure.
Thank you for being here today. Still ahead on Jenny. As we've heard from Dr. Sullivan, heart disease is the leading cause of death among women, so it's really important to know the warning signs, what one national group is doing to help when we come back.
Jean and Vernan Baxter say they don't do a lot for Valentine's Day, but there might be some chocolate involved.
I'll get her a couple boxes of chocolate turtles.
But it's fair to say these two have had their share of Valentine's Days together. This August, they'll celebrate their 80th wedding anniversary.
Well, I'm 102. Right.
But don't let their age fool you. They remember the day they met like it was yesterday. It started when Vernan walked into the auto garage Jean worked at.
My youngest brother said, you should have been here. A girl brought in a Ford pickup, slickest chick you ever seen. And sexy looking, he said.
Jean found her nearby and the rest was history.
She just hung right on to me. She met me on the 17th of January. Boy, she got me married the 22nd of August.
The couple says they took a lot of trips over the years, had 3 children, and still nitpick at one another.
I don't like his haircut sometimes.
And after almost 80 years and a lot of memories, they're still going strong.
Well, we both got older and smarter, but she's been real good, been just a terrific wife. Couldn't ask for anything better.
Nothing better than decades of love for this 102-year-old couple.